1-800-698-2411 and press 9. Again, that's 1-800-698-2411. If you are interested in taking a survey at the end of this call about your experience with the VA hotline, press 1. If not, press 2 to continue.
Thank you for calling the VA hotline. My name is Mandy. How may I help you?
Hello, ma'am. My name is Matthew Meditz, and I just tried calling up, and I couldn't really speak to the person. They were having there was a problem with their mouthpiece or whatnot. So I'm glad I can hear you better. I tried calling up the other day to address my concern, and um, I felt like I might have not been ready for it and such, and I actually wrote it down this time to be a little bit easier with my information. And so I'm not trying to be a bother or anything. Um, but yeah, like I said, I did try calling the other day to address this, and I'm not too certain if there's anything that's already in there. But I like I said, I wrote things down and to try and keep things better orchestrated and such. So thank you.
Let me get your first and last name.
Yes, ma'am. It's Matthew Meditz. Well, it's just
Oh, I'm sorry.
the entire system in itself. 'Cause I've been dealing with this for 14 years, and they're like they withheld medications from me, treatments. They took my gun rights when I went in for pain. But yeah, like I said, like I called up the other day. Well, I was just trying to address one thing, but then like it just turned into a bunch of other things. And I'm like, well, let me write this down, and yeah, and it turned out to be a lot.
So, and we have, subcategories. So is it you're not receiving care at your local VA?
Um,
Coordination of care? Is
so I
it a
went through
community care referral?
so I'm medically retired from the Army in April 7th, 2012. I went through the integrated disability evaluation system. So I'm medically retired with 30%. So I got my 20 years benefits, 45 days less than 4 years in my medical retirement. And I was one of the first people to go through the integrated disability evaluation system. And so it should have been like a seamless transition from the Army into the veteran care. Um, and it wasn't. Yeah, like March 2014, I went in for pain flare up and such, and also, and then I was um, in restraints. I was being forced medication, and then I was temporary detention ordered. Then I was threatened with 30 days of detention, or if I
Oh, I'm sorry
didn't,
to hear that.
and I couldn't do
And
that
that happened in
because
2014?
yes, and yeah, they threatened me with 30 days of detention if I didn't like to the magistrate and such, and they and so like I was like I can't afford that, and I signed my rights in my I was red flagged, so like 3 days I was temporary detention order, and like I said, I just went in for a pain flare up and whatnot. Like I was going through a lot of stress and such. I mean, 'cause, like the whole school thing and whatnot, but yeah, and so like I thought I was having like I mean, young male and whatnot, but I was in the army and such. I was like 30, like 28 when I got out of the army and such, and so it was like about 29 or 30 when I went into the hospital there, and they and it's like I said, I was having like a pain in my chest, and I thought that like might have been something heart related. I mean, you never know and stuff, and so yeah, and then like I said, I was detained. I was put in a box with security, uh, and yeah, then like I said, I had to sit down like with some guy like that worked with the magistrate, and it's like, and yeah, but
So,
and
due to that incident back then, you're having issues now?
it's even worse.
So specifically, what issues are you having at the medical center? Is it receiving care,
Yeah.
referrals,
Well,
medications?
for instance, like I suffer from insomnia, and they will not give me insomnia like Lunesta. That's a medication that actually works for me. They will not give it to me,
Okay.
and it's like they want to put me on all this other stuff, and it's like I don't have like I'm not depressed. I'm dealing with things like I just need help with my sleep, and they want to put me on like these psychotropics that I have bad side effects with. Like in December 23rd, 2025, at 10 o'clock, 10 p.m. to 4 a.m. On the 24th, I was having a parasomnia episode induced by the Seroquel quetiapine medication I was on. And a parasomnia episode is sleepwalking, and I was also doing like acts of like self harm. I bashed my head into the mirror, and I couldn't stop myself. I was like, I was walking around in a
So
like,
the main issue is your mental health medications.
well, Lunesta,
Sleep medications is
yeah, like,
prescribed
well,
by a
just they
mental health
want like,
clinic.
well, I'm trying to get my insomnia because that's the only thing I need is help with my sleep. Then they don't will not give me anything for it.
They're refusing.
Right?
Okay.
They want to put me on
So
like
I
all
can
this.
route a concern case specifically that you've requested the sleep apnea or sleep medication and that you're being denied. I do need to document who you talked to regarding the sleep medication.
I'm not. I mean, I've been just dealing with the psychiatric people at the Veterans Affairs Hospital in Salem, Virginia. That's the one I go to.
Salem, VA.
Yes,
Bear with
ma'am.
me. Let me pull up your
Yeah.
medical center.
And I'm sorry, I'm not trying to be difficult with you, ma'am. I thank you
Oh
very
no,
much
no.
for your.
I have specific questions. I mean, I I want them to address your issue. I don't
Yeah,
want to put information that's not. I mean, I usually document specifics and to the point.
I, yeah, I
What
don't
the
want to
issue
bombard you with
is.
needless information too that you're not able of
Well,
handling
they don't
too.
pay attention. They don't pay attention to our cases. I don't want them to. And again, I sincerely apologize for
Oh, it's not
everything
your
you've
fault, ma'am. Thank
experienced.
you.
And especially with being, admitted against your will. Like I said, I don't wish that upon anybody.
Oh yeah, it's
I just don't want them to focus on something from 14 years ago when
well, that's what they're
the issue
doing. Like that's the whole
is the
thing.
sleep medication.
That's the whole thing.
Yeah,
'Cause,
they're
like
basing those decisions.
yeah, like I was in a hospital because in 2023, May 4th, 2023, I was in a hospital for 45 days because I overdosed on inhalants. I was using air duster to help me sleep, and
Oh, what?
I never, of all the drugs, I never thought. I mean, I'd overdose on air duster. Like that'd be the one that killed me. But I coded for 18
What's
minutes.
an air duster?
Keyboard cleaner, like the like a
Oh,
yeah.
the compressed
The
air.
compressed air, yeah. Yeah.
Wow.
Yeah. I was using that to, tell me to go to sleep. Like, that was, like, the only thing that worked. I mean, like and I didn't like, I was using it for years. Nothing never had a bad side effect with it until that one time, and, like and, yeah, I coded for 18 minutes and such, and it's like and, like, that's the whole thing. It's like, the VA, they
They
well, they're like, "Well, we can't give you the Lunesta because you're drinking and stuff," and it's like, "Well, I'm drinking because I'm doing this," and it's like I cut back on drinking. I did everything I was supposed to, and there's always more hoops I've got to jump through with Veterans Affairs in order to get the
oh,
medication. They're like withholding
that's
it. They're gatekeeping, and I've also got it on record too.
it's not just the VA.
Right.
That's every
Well, it's
outside doctors are the same, especially with sleep medications. Um,
well the
so who
ER
did you
doctor
last
too.
discuss?
I'm sorry, like
Did,
so I went in for a pain when I a pain flare up this February, and the doctor told me to come back in 2 weeks. It was still persistent. I go back in 2 weeks, and the ER doctor's like, "Well, it's kind of hard to treat it, like or it showed that, like the MRI. He said that my MRI from 2010, when I was still in the army, it showed that my area is a mess, and that it's hard to treat it because my mania and that I belonged to 170, the psych ward." And it's like, I've got that on recording. And it's like, what does that have to do with anything? And it seems like that's their answer for everything. They don't want to deal with the problem. It's a psych ward. They just want to throw, these, the quetiapine and the Seroquel, these, and then it's like, I tell them that, like, I don't have bad side effects on it because I'm not depressed. You're putting on things that I'm not suffering from. I'm suffering from insomnia, and you're putting on all this other, and it's like, you won't give me your drugs, so I'm using my drugs and they're killing me. You want to do something about veteran suicide? Freaking what? Give me my fucking sleep pills. Pardon my mouth, man.
Well,
Uh,
well, Mr. Meditz, I can document that. I am going to ask kindly you please not curse because we
I'm
are on a
sorry. I'm
recorded
sorry.
line, okay?
I apologize, ma'am.
It's okay.
I
So I just have
apologize.
to ask 5 simple questions. Who
Yes,
did
ma'am.
you discuss the Lunesta with, the
I've
sleep
discussed it
medication
with
with?
every
Who
single
was the
one of my
last person?
providers. I don't know them by names.
Do you
Well,
recall when you discussed it?
Megan Pittman is my substance abuse counselor that I'm dealing with right now. And so I spoke with her, and
When did you talk to her?
I spoke with her yesterday.
Yesterday? Okay. Bear with me. Let me
Oh
document
yeah,
that,
no worries.
okay?
I'm sorry. I'm going to take a breath.
No, 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 no. Like I said, we're going to keep it simple and straight to the facts. So I'm going to put veteran discussed sleep medication. And you said she's your social worker or counselor?
Substance abuse counselor.
So, okay.
And that's the thing is like, I'm a combat veteran. I'm infantry combat veteran. How do I not belong in a PTSD program? How can I not get into the PTSD program when I'm 100% PTSD? How can I not get in that program?
I can't answer, sir.
Exactly. Neither can I.
I
But they
don't
want
know
to say
how
I'm in one,
they're.
like, but they want to put me on 170. They want to put me in the psych ward. That's their answer. Like I'm getting tired of this treatment. I deserve that. I mean, I've
I'm
freaking
sorry.
just finished my class. Like next year, I'll have my bachelor in business entrepreneurship. I mean, I'm like,
And you
I
said
don't know where these people
you're
are
at the
getting.
Salem VA in Roanoke?
Yes, ma'am. Well, yeah, it's
Bear
Salem,
with me
Roanoke.
here.
It's like one big city,
Okay.
one big town city. And I'm sorry, like this gets me all worked up and stuff.
Well, don't. We're like I said, we're
Oh,
just
that's why
going
I
to
wrote
keep
it
it
down.
facts
That's
to
why
the
I wrote it
point.
down.
I don't want.
Yeah,
Yeah.
to keep it
No.
up.
Oh, and when you discuss it, I'm going to put that you discussed the sleep medication with Megan, substance abuse counselor at the Salem VA Medical
That's
Center, and you
correct.
said this was yesterday.
Yes, and there. I also spoke with Elizabeth Stein. I was in the PRCC program. I can't remember what it stands for, but I was doing group therapy there, and um, yeah, and I didn't belong in that
So,
class.
regarding the discussion with Megan, again,
Yes,
I'm
ma'am.
going to put who the last person you talked to regarding the issue.
Okay.
Once I create the case, and
Yes,
like
ma'am.
I said, we're going to keep it simple to the fact what you were
Yes, ma'am.
told. Um, once I create your case, you'll have a case number. Your concern will be sent to local medical center leadership and patient advocate that have the access, authority, and ability to address the concern. Their case resolutions are reviewed, approved, and closed by the Veterans Integrated Service Network, also known as the VISN. So when you discussed the issue with Megan, what did she say regarding
She,
the
she will work with
sleep
me.
medication?
She's gonna work with me with my psychiatry appointments. So I mean, she's saying, but yeah.
Yeah,
So
because
like,
ultimately it has to come from that department. So she was
right,
going to assist you with the mental health clinic?
right. I mean, but yeah. I mean, that's where it's coming from and such. Yeah, it's like that's the only thing I'm like. It's I just need to get my sleep in order. Like that's my only issue. And it's like we get that at a
And we'll
baseline.
document that. We'll document that because it affects a lot of things. Sleep affects everything.
Like that's what I'm,
Your mental health,
trying
your
to say.
physical
Like it
health.
messes with everything.
Yeah.
And
Yeah.
like when you don't get enough sleep, it's worse than drinking. Like
So she would work with the mental health team, your
I'm,
mental health team?
I don't know. No, I mean like she said that she would. I mean, but I mean the thing is, it's like the effectiveness, and it's like they're not. It's like I'm telling you what actually works for me. You know, like why is it so hard to like? I'm not asking for a freaking like to get high and stuff.
Uh,
I'm asking for sleep. I mean, and that's like they're withholding sleep from me. I mean, like
nope. And
it's
all I can
freaking
do is
cruel.
request
And then at
that.
the same time, like I'm going through pain, and freaking, it's like, well, we can't treat your pain until you get your fixed. Well, it's like I'm in pain, and freaking, and so it's well, you know, and I can't get my pain treated, and freaking, then I get my sleeps, and then it, it's the vicious cycle, man. I've been dealing with this since freaking got like since the army, man. Since I lost my freaking job.
Now, prior to discussing it with Megan, were you denied the sleep medication by your mental
Yes,
health providers?
yes,
Okay.
yeah.
Nope. I'm
Now
just
I
going to
freaking
document that and that you're requesting that you be contacted to discuss why you were denied.
well, I mean, in
That's all we
discussing it,
can
I mean,
do.
like, see, I just, I'm not gonna. There's not gonna be any answers. I mean, like that's the whole damn thing. Is like, freaking, you want to stop veteran suicide? Just listen to us, damn it. You know, fucking, that's all. I'm sorry, man.
Sir, all I can do is route a concern case,
I
sir,
understand, man.
that you have been denied in the past for it and that you're
I understand.
requesting to, discuss the medication is that you're not getting any sleep at all.
Yes, ma'am. Thank you.
Nope. And you said specifically it was Lunesta?
Yes, that's the only one that works for me. I've been on Ambien CR. Friggin' Lunes is the only one that works.
So you've been on it before.
Yes, I was down in the army. Like I had it in the army. Like I don't know why you friggin' didn't give it to me in the VA. You know, it's like the only medication that friggin' worked for me. You know, and
And
like
I'm going to document exactly that
I
you're
mean, I'm doing
requesting to be
school and everything.
prescribed
I'm like,
Lunesta as it has
yeah.
worked in the past.
I mean, like I'm doing everything like I'm supposed to. You know, I don't know what else I mean, I don't know what else I'm supposed to do.
Sir,
Yes, man.
what we're doing now, and that's routing a concern case. Again,
Yeah, I
I can't
appreciate it.
make
I'm
those
sorry for getting emotional,
decisions.
man.
I
Thank you.
can't. I know you're
I,
upset and you're frustrated, but again, I can't make those
uh,
decisions.
I'm
All I
sorry.
can do is document it,
I
okay?
understand, man.
And I have here, veteran discussed sleep medication with
Yes, man.
Megan, substance abuse counselor, at the VA Medical Center
It's
yesterday.
just good work, man.
Veteran was told that she would work with his mental health team. Veteran has requested to be prescribed Lunesta as it has worked in the past in
Thank you, man.
assisting veteran to get sleep.
Thank you. That I appreciate your help.
So right now you're not, how long are you sleeping?
Um, well, it's like I didn't sleep last night. I mean, like it's I'm up for like 30 hours,
Okay.
at least. Like I don't
So you're not
have like a
even
regular
sleeping an
schedule and
hour a
such.
night.
I'm sorry.
You're not even sleeping a couple of hours a night.
No,
You're
I
staying
mean like
up.
I did.
Okay.
Yeah, it's like I mean I'll stay up till like whenever like the day's still just beginning. And it's like I was up all night doing I mean, just finished my classes, finished my assignments and everything. So, like,
And you
so I got
previously
like another,
were denied at the VA though, correct? Your mental health team previously denied it.
that's correct. Like, they want,
Okay.
they want to put me on all this other stuff that I don't need. Like I said, like
Okay.
Circle and
Nope. I just needed to.
yeah.
I just need to add to it.
Oh,
I'm
yeah.
gonna
I'm sorry, man.
put that you asked your mental health provider in the past and was denied.
Yes, man. That's correct.
Okay. And then I'll end it with you're requesting to be prescribed as it's worked in the past to help in the past assisting veteran with sleep.
And so like, I have no problem like doing like, uh, pill check in or whatever the case is. I mean, like,
I
there's
don't
ways
know
to
how it
regulate it.
works with,
I mean, like,
again,
yeah, like, I'm willing to,
it's
like,
not just the VA. This is outside providers also.
yeah,
Just if they want you to try stuff, just I tell veterans, sometimes you got to jump through hoops, and it's not just one medication; it's other medications. Um, the GLP ones, a lot of veterans request those. Those you have to be in the MOVE program. You have to be seeing a nutritionist. So there's a lot of steps that they want you to
wow.
do before they'll prescribe those.
I mean, like,
So
it's
anything,
just
like I said,
insomnia.
if
I'm
they're
diagnosed with insomnia. It's like, it's my
yeah.
records.
So but
Like,
again, if
pizza.
they want
So,
you if
I,
they want you to try other stuff, don't just try it, because in
no,
order
it's
to
like
get where you need to get,
that's what they
sometimes
do.
you
No, that's the whole thing is they put me on other stuff, and I have side effects with it every time.
yeah.
That's how I got 2 Article 15s in the army. You know, even address
Well,
things.
I'm
That's what I'm saying.
sorry, and
It's
I'm
like
going to
I've
route a
had side
case,
effects with
and
medications. You know, and
we're
it's
going to
just,
put what you're requesting.
I mean,
We'll
like,
put that you've discussed it with your providers in the past. It was denied, and we'll put,
it's a effective medication, the only one that works, and it's like I don't understand
let me
why.
change that. I'm going to change that. Um, I'll put that you're requesting to be prescribed Lunesta, as it has been the only medication that works.
Thank you, man. However strongly worded we can make it. I appreciate your. Thank you
No,
so much,
no,
man.
no, no. And I'm nope. Let me bear with me a second. So I'm going to route your case. Again, they'll contact you from leadership. We're an intake center here. And
Great.
like I said, I changed that last sentence to only medication that has worked, okay?
Thank you, man. It
So that
does.
it affects a lot. And I sincerely wish you the best of luck,
I
okay?
know it, man. I believe you, and thank you so much. You know, I really do. You
Oh,
know,
you're very
thank
welcome.
patriots like you
Enjoy.
who serve us.
Well, thank you for calling the VA hotline, and you enjoy the rest.
2411 and press 9. Again, that's 1-800-698-2411.
My name is Yvette. How may I help you?
Cool, man. I just called up and well, I need to add something to my case.
All right.
Just
May I have
called it
your
up.
first and last name?
Yes, ma'am. So I'm trying to. I wrote this down like
Yep.
the other day. I'm trying to find it.
I'll be to be prescribed Lunesta.
Yeah, but I also had an incident here recently with so uh, earlier this week I was on it was the 20th. I had an appointment with my substance abuse counselor Megan Pittman, and
Mm-hmm.
I got loud during my appointment, and I know like
Mm-hmm.
it's not to be tolerated and stuff, and like I was, but that's why I'm going to the counseling and such, to work on that. And well, when I left the appointment, I was accused of yelling in the hallways and flailing around, and I did not. Then I also have it recorded on a conversation that she made claims that I threatened to bring a gun to um the campus, and I am tired of like this. That's all they're doing. That's all everyone says. They always bring up, and that's why I had a body camera, so I can't be accused of freaking these false allegations that people accuse me of. These people are insane, and I'm
So do you
trying to
have
get
it on?
treated. I'm trying to get like I'm trying to get my pains addressed. I can't. It's like I can't get anything done. I can't get my sleep addressed, and I can't get my pain addressed. And I don't know why. Like uh, it's so difficult. I've been dealing with this for 14 years. I mean, that's what and it's just like nothing's getting any. I mean, I'm just trying to get like anytime I like try to make progress, it like they keep me like a patient. They're making me this disgruntled patient, and I'm not. I mean, well, I am because freaking they're withholding medication from me that actually works, like the Lunesta, and they're putting me on all these other medications that I don't need because like I'm functioning just fine without them. I just like I finished my classes this term, for my business entrepreneurship. I'm doing fine. Just like I'm having a hard time. Like I suffer from insomnia, and it's like I'm trying to address these, concerns, and it's like they blow up because it's like I'm not sleeping, so it's hard for me to maintain my emotions and such. And it's like they're telling me to calm down. It's like I'm trying to calm down, but you're not, like you're withholding medication from me that actually works. And it's like I try to, and then I get mad, and then freaking it causes security issues because and then people whatever, and so then it makes it even more difficult for me to get my health cares needs met because freaking people are in fear, and so it's like I said, I have to bring a body camera with me, to protect myself because I don't have anyone with me, and everyone is just keeps on saying I'm freaking. I I
Don't
don't understand it. My first
you,
quarter, like, college,
well,
I got a
give
teacher
me 2
freaking
seconds.
fired.
And so, okay, when you're having that strong conversation with the counselor, and you have it recorded, did you say that about the weapon, or
I
it's
did
not
not.
on
No,
the
I did
tape?
not. I did not. I don't speak that way. And then the thing is, like, that's extremely. That's
Hmm.
I've already got legal issues because of freaking someone accusing me of saying I threatened the Commonwealth attorney with a lawsuit because she mishandled my case I had against someone who assaulted me, and she claimed I said something that was not what I said, and yeah, no, and I'm paying punishment for that. And so it's like now it's like I'm dealing with it again. I mean, I've been dealing with this for the last 14 years. I mean, really 16 years. Because I've been documenting this stuff, like just the medical care that veterans go through. I mean, this is insane. Like what I've been through. I mean, like almost 2,000 words I wrote the other day. Like I mean, I was trying to. I mean, I could easily go on more, but like that's what I'm saying. Like this is like something so simple they exacerbate it because like I said, like the Lunesta that's the only thing that helps me, and then it goes all the way up to a security threat, and it's like and it's like why can't they just? I'm not asking for a lot. I've had bad side effects with their medications. I've freaking OD'd on inhalants in May 2023, and because I was used street drugs to help me with my sleep because the VA won't give me medication that actually works. And like they want to do something about veteran suicide. Like how about listening to us? I know I'm a combat infantryman. I was in Iraq. I was blown up. I'm not one of these pogues. Like I was an athlete. I lost my job. I mean, I can still out PT a lot of people, and it's like Veterans Affairs, like just they want to turn me into a mental patient, and it's like I'm just trying to live my life, and it's like and see like and they just create this whole freaking narrative, and this is what I've been dealing with since the army when I was in the warrior transition unit. Like this abuse is ungodly. I mean, that's why there's this line. And I'm sorry for having a meltdown. I apologize, man. Thank you
That's
for listening.
okay. Do you feel like you're considered anything, or you're good? Do you feel like you're good, or you feel like you're not good, or
Yeah,
I know that
I'm
this is
no,
really, it sounds like a bad situation.
I
That's why
don't
I was
want
like,
to make
wow,
you
that's
feel
something.
uncomfortable. I don't want to but I
Oh, no, no,
also
no,
don't want
no,
to
no,
say like
no.
too much
No, no, no.
like that. I mean, I'm not too certain like what's the scope of this line,
No, it's okay.
and so I'm
Okay,
just
so,
yeah,
okay,
'cause I
so
got
I
that
just
through a lot.
wondered about that because it just, yeah, I mean, that's a lot. You go over there, you're asking for Lunesta. and then voices are raised. That's what I heard you say. And then your counselor accuses you of threatening to bring a gun,
Right.
and you said you have the conversation recorded,
Yes.
and you did not do that, and you feel almost now like you have to have a body cam in order to protect yourself because
Yes,
that's
ma'am. Yeah.
mhm.
And so, and it's all, and it's like even my, so I'm not gonna retire from the army due to my injury, shoulder, back, and hip. And it's like even treatment for my ailments, my actual injuries are being gate kept by the physicians. And it's like,
Mhm.
and it's like their answer is just putting me in a psych ward for everything. And it's like, and I don't understand like why they want to take my life away. You know, like why they want to like. I'm trying to live a productive life. You know, they're doing everything they can to freaking make me a mental patient. You know, and it's like I'm doing my classes. I mean, like I'm freaking. I've struggled because of freaking it. Like, man, it's just not easy and such. But you know what? I'm doing it. I haven't given up. You know, a lot of
Yeah.
people struggle like in life and whatnot. You know, and I overcame this. Like, I'm not. I've got a positive outlook on my life. I don't need to be on antidepressants. Things are going good in my life. Why are you going to put me on pills that I don't need, like to because I'm not feeling the. You see what I'm saying? Like that's
Yeah.
and it's like they want to like make me out to be this person like that I'm not. I mean, I used to be that way, but I'm not anymore. Like you know, and it's like it's kind of hard to get out of that shadow. Like they can't see that like I've healed and stuff. And then it's kind of hard to show it too because like I'm getting frustrated because it's like, can't you see like I'm not the same? Like you're looking at the page, you're looking at the screen, but that's not me. I've changed a lot since then. You know, and it's just like they won't listen. Like it's they're just not getting through. They just read what everyone else said and they're just stuck on the damn blue screens. And then they get their all these little concoctions in their head and these little narratives to where they're freaking saying, "Oh, I'm going to bring a gun." That's scary. I'm not the one who's sick here,
Yeah. And the thing is, like you said,
and I'm sorry for. Thank you,
no,
man.
it's okay. No. I've heard far worse, and I've heard people really breaking, and not that your information not serious. That's a heavy situation to be asking for
It,
Lunesta, and it escalate to,
yeah,
you know, are you threatening to bring a gun? And you're like, I'm not threatening anything, and that's like probably what you should have screamed out. I'm not threatening anything.
no,
You
yeah,
know, that those are your words. You should have told her something like, those are your words. Those are not my
oh,
words. I never said anything about that.
well,
Did you say something like that to her?
no, no, I mean, I freaking, I yelled at. I was like, "What the fuck is wrong with you?" And like, I hung up with her. I was like, 'cause I couldn't. I mean, I was ready. Like, I just went ballistic. I was like, "How dare you? It's like say that."
Oh.
You're damn
It
right.
was
I
kind
freaking
of
got
like
pissed off. I went to.
triggering.
I
Yeah,
was. I was
triggering.
furious. She
Hmm.
threatened my life. She
Yeah,
threatened my freaking life. Making a false claim like that.
yeah.
She made a. She threatened my life. I had to buy a body camera.
Hmm.
I just bought one. I mean, I can't do this anymore, man.
Yeah, I mean that's it escalated so much, and you were just asking her for Lunesta so
Well,
you could sleep. So that's the sad thing, and you're trying to get better. That's the whole point.
eh,
You're trying to
well,
get
and that's the
better,
thing. It's
and
like, yeah,
yeah.
I'm sorry for getting loud in my appointment and stuff, but you know, that's why I'm there. You know, and it's like freaking if I'm not gonna be able to freaking like have my outbursts there and like learn how to deal with them, then like where the fuck like you can't just put me on pills and shut me up. That's all they want to do. There's no freaking talking. There's no talking. It's just pills and shut up. That's all it is. And you know we're not. And it's and then anyone else if you say make any noise, freaking you're a bad patient. You're a psych ward. You're a nutcase. That's all they say. And it's like, I'm a freaking damn good soldier. And they took my freaking life.
So if you speak up, automatically they're like, you're a mental patient. You've got to be
Yeah.
locked up in the
Yes.
ninth floor or whatever.
Yeah. 170. And so it's like, and I mean, I went through this in the Army. I mean, it got me under new staff, new training, command sergeant major, 33 years out of the Army.
Hmm.
When I'm frequently able to get my reports to Brigadier General Keith W. Gallagher. So I know what one person with right information can do when they follow proper leadership. Like, that's why I'm doing this stuff. Because I've done it before. I fixed things, and like, friggin', this is a really big mess. I've been dealing with it for 14 years, and, I'm only going to fix Veterans Affairs one day. Mark my words. Because, friggin', I'm so many friggin' soldiers, man. I know that how so many families got destroyed. So many families. These monsters. They're monsters. Absolutely monsters. These sick bastards. I'm sorry, man.
It's okay. I mean, like I've heard other veterans talk about marching and the soldier next to them was shot in an attack or something, and it is heartbreaking to have those memories, um, and just it's heartbreaking to hear that all the time.
Uh,
But
it's okay,
yeah,
man. I
and
appreciate
then the
it.
thing is,
Oh, what's that, ma'am? I didn't mean to cut you
so
off.
if you
Oh,
speak up,
oh
you're
yes, ma'am.
considered a mental patient, and you're
Right.
being threatened to be put in the psych ward.
Well, it's like what they say, like trying to like put the round peg in a square hole or something like that. And it's like I'm not like they're making me out to be a bigger problem than I am. And the thing is, like, then I don't help my case because get I get angry, in my appointments and stuff. So freaking I lose my case and freaking and then I go through these things and freaking and like I said, like I don't there's no one ever gets threatened. Like no one like I don't threaten anybody. Like the system is all messed up. This it's emotional. Like that's what these appointments are. And it's like, and I'm sorry, I get behind a closed door and stuff and freaking my emotions come out. I think I'm in a safe place and I'm not. I'm sorry. I thought I was in a safe place. And like and it's like, no, I'm not in a safe place. And it's like, okay, oh shit. And it's like I understand, like, it's not just, me, like, at the place and whatnot. I understand there's other people, but we all have moments and stuff, and it's how we learn from these moments. And it's like, how much, so, like, anytime I speak up, anytime I freaking say, I got to worry about the police. You see what I'm saying? It's like, I'm in fear now. Like, I can't, I'm in fear going up there to the point where I have to buy a body camera to get my health care. That's the severity of the situation here.
Oh,
And it's like I'm trying to get my treatment, and it's like, well, I'm in pain constantly. Freaking, I'm not sleeping. I'm not eating right because I'm not, I look like hell because, it, insomnia. And they're not treating my freaking insomnia.
hmm.
And it's like all these other issues. And it's just sleep. I mean, I haven't slept since yesterday. Like I don't know, like, and even still, it was like only a couple hours. Uh, Like I don't sleep. And that's
So
where
you're fearful
like all my
because
mental like cases
the
come from,
counselor
man.
can make anything up.
I'm sorry.
you're fearful to go to the Salem VA Medical Center
Yes.
because your counselor Megan can just make anything up and
Right.
write it up.
Yeah. And it's like, I know, like, I'm not perfect. I'm far from perfect. That's why I'm going to get help. But it's like there's just always factors in a way. And it's like you want to stop better than suicide. It's like, and I'm not suicidal, homicidal, genocidal. No one's life is threatened or anything like that. I'm not a statistic. I'm an outlier. Freaking, I'm making certain like my efforts are going to save lives. They're not going to take lives. So that's like that's it shows like my growth and such, like my intent and like my like desire to move forward, like to have a positive outlook on life. Like I don't know where like there's just stuck in this depressive state. Like, and I'm sorry, I'm not that anymore. I would like to put that behind me, but I can't because people are still stuck on that. Like what was like 14 years ago.
Like the
And like
anger, you want to put
understand
the
like there's
anger
still.
behind you?
I'm sorry.
Sorry to interrupt you, but you want to put like the anger behind you or the
Well, like,
triggering behavior? Like what do you want to put behind you? Like um
well, I've been consistent this entire time. Like the entire, I've just sleep medication. That's and then friggin' because that might even help with my pain. So why not fix my sleep? It's a simple thing to ask for. There's medication specifically for insomnia, something I'm suffering from, something I get compensated for a disability. They're blatantly withholding medication from me that would help me. I don't know how much more clearer I can be. And I don't know how complicated it is to be, follow through with this request. I mean, I've been on Ambien before, and no problem put me on that. It doesn't work for me. So, like if they can do Ambien, they can do Lunesta. So why are they not doing it for me when they did Ambien before? I'm 100% permanent total.
was it Ambia or was it Lunesta?
They prescribed me
Ambien
Ambien.
or Lunesta?
They prescribed me Ambien. But Lunesta is the one that works for me,
Hmm.
and they will not give me Lunesta. And bless your heart, man. Thank you so much for your patience and help me get through this. I'm not the
It was
easiest person.
heavy. It's a lot. It's okay. It was a lot, and I'm. It's a safe place. I mean, you can tell me what went on yesterday, and it's absolutely fine. And I can understand the fact that you didn't say anything about having a weapon, and all of a sudden that's brought up, and it could be triggering as well because you're
Uh,
like, where did that come from?
well, I
But
was,
good thing you have this conversation taped.
yes, and well, I was, well, I wrote things down and whatnot, and I was just trying to keep things in, like, I didn't want to over talk and whatnot, so that's why I didn't include it in the initial message. And I was just trying to be brief, and then I, you know, remembered like because that was like what inspired like the rest of it too. So like there was just I was just trying to be better organized, and I poorly organized myself. And so I'm sorry that like I said, I'm not trying to be a bother. Like I
No,
just got done
we
with
can
my.
always add to the concern. We can always add to the concern.
I mean, like yeah, just I mean, it's like I said, I haven't slept and stuff. Like I just got done with my homework assignments and all that. Can't believe this quarter's already over.
Is it a service rated condition? Your
Pardon me?
actual insomnia? Is it a
Oh yes,
service rated condition?
yes, yes. I'm 100% source connected. Um, yeah, but let me actually read off my thingies. So yes. So 100% rating for post-traumatic stress disorder with cannabis abuse, claimed as depression, anxiety disorder, insomnia, and PTSD. Effective date December 30th, 2014. It was originally like 70%, but I got to 100%. Then 30% rated for migraine and tension headaches due to traumatic brain injury. 10%, so that's the other thing too. Like they're not handling me with like that have disabilities and such too. Freaking, I do have traumatic brain injury. Freaking, I do have hearing issues. Um,
Hmm.
let me go through them and stuff. So 30% rating for migraine and tension headaches due to traumatic brain injury. 10% rating for status post left hip femoral osteotibial impingement arthroscopy. I had surgery on my hip, and there's damage like to my leg and stuff like, and so I got my full movement in my left leg. 10% for left shoulder labral tear. 10% left knee. 10% tinnitus. I mean, he got like bilateral flattened arches, but that's just my genes. But I don't have any rating on that. They just haven't noted. Just like a few other things. 10% rating for lumbago with arthritis and thoracic strain. 10% rating for cervical muscular genesis. Uh, and yeah, I mean, so that's what I'm paid for.
Hmm.
So it's like I'm not just talking about my butt here.
Yeah.
Like I was in the army, like I was infantry. You know, May 22nd, 2008 to April 7th, 2012 was my enlistment. Uh, I was a athlete. It was infantry. Wasn't like if I could have gone to Rangers. I mean, that's what like how we trained in my company and such. But I was on deployment and all that. But that's how we trained. Like so, we were ready for selection.
Hmm.
Alpha Company. And it's like,
And you said
oh,
you're
pardon me, ma'am. Oh,
100% PNT.
yes, ma'am. Yes, ma'am.
Sorry to interrupt you.
Oh
I
no,
just
you're
want
fine.
to
You're
just make
fine.
sure that I get
Uh,
that in there.
no, you can interrupt me all the time. I can start running my mouth and get carried away. So
No, I didn't mean to interrupt you.
no,
I
you're
just
fine.
want
I
to
was
just make sure I get that in there.
yeah, by all means.
Let me go over this
Yes, ma'am.
concern that we've added this
Absolutely.
information just to clear it with you
Yes,
because I
ma'am.
want to be transparent with you.
Thank you.
And so we're adding the concern from earlier. Veteran said he was speaking. Veteran said he was speaking, and it got loud with Megan.
I had an emotional outburst during an appointment with Megan Pittman, my substance abuse counselor, and
Okay.
that escalated into an intervention with the law enforcement and also her alleging that I made threats of a gun.
So let me go through this because I did put that
Okay,
in there.
okay,
Veteran
I'm
said
sorry,
he
man.
had an emotional outburst and it got loud with Megan, his substance abuse counselor, on April 24th, 2026, because he asked for Lunesta
Correct.
because he cannot sleep and he is not a hostile person. And they accused him of threatening to bring a gun um, to the
Salem
Salem
VA
VA
Hospital.
Medical Center.
Yes,
And he did not. And he has the conversation recorded, and he never said that.
I have two
Veteran said,
conversations. I have the voicemail. and
Mhm.
what, and then also the conversation I had like yeah, left her a voicemail, or
Mhm.
I spoke to her on the phone, then I left her a voicemail, and then I um got a call from her saying like why referencing bringing a gun up, or I don't remember if she called or if I called, but there's a conversation that occurred on the 21st, um, and where she referenced me saying I was referencing bringing a gun, and that's
And he said he never said that on April 21st, 2026.
correct. Yeah, I
The
never like
veteran said, yeah,
yeah.
said the answer is to put him in a psych ward for everything. And he is doing his classes and he's trying to get better. The veteran said that he does not want um, antidepressants um,
Because I'm
or
not the
to
Trump.
have many pills prescribed to him because he feels like his life is getting better and he is optimistic about life. The veteran said that
Yes,
if he speaks up, he's considered a mental patient and he's being threatened to be put in a psych ward, and then they are just giving medications and there's very little speaking or counseling.
that's correct. That is absolutely correct. Like there is no counseling. Like there's just punishment. You know, yeah, I had an outburst and such, and it's like, and then I get punished. You know, like how am I supposed to
The
get better?
veteran,
I mean, like
the
I wasn't.
veteran said
Yeah, I'm sorry. What was that, ma'am?
The veteran said that he is fear to go to the Salem VA Medical Center because the counselor Megan can
Yes,
make anything up, and now he fears getting treatment. The veteran said that he is making an effort to make his life better, but but he
Veterans Affairs is getting in the
had,
way of like my health care. I mean, even
yeah,
with, because I had an incident last, like I was a victim of an assault, and that's a whole another case and whatnot. And I was supposed to have surgery April 1st of 2025. I didn't have surgery until April 1st of 2026. I just had it this month. The VA messed up my surgery for over a year. That's how freaking bass backwards this place is. You know, this they're and it's like they have a comment. There's a trend with the paperwork with their with and it's like because I'm calling them out on their paperwork, they're calling me psycho.
the veteran said that he's making an effort to make his life better, but he had an outburst um, with Megan, and he wants to put the past behind him. And the Salem VA Medical Center has not fixed his insomnia, which can cause um, agi-
Severe
agitation and
agitation
frustration.
and like all the symptoms that they're describing, like all this everything that they're describing, like that on, and it's like that's everything that stems from insomnia.
And
You
he
know,
has
but
a short temper
they want to throw
because
psychotropics at it.
he has not slept.
I'm sorry, ma'am. I was yapping. You're doing
Okay,
great.
and so and he wants to put the past behind him, and the Salem VA Medical Center has not fixed his insomnia, which can cause agitation and frustration, and he has a short temper because he has not slept. The
And
veteran
he's in the
said that
pain,
he got
constant
upset.
pain. I'm in
Yeah,
constant pain too. You know, like keep that in mind. Like I'm in constant pain all the time, and I'm not sleeping. And like, like that's gonna leave. Anyone's gonna be cranky.
hmm
You know. I'm sorry. Like I don't care who you are. You're gonna be cranky. It doesn't mean you're psycho, right? You're gonna be cranky.
hmm and he has constant pain and he's cranky. The veteran said that he got upset because he knows that Lunesta is being withheld from him and it works for him. Veteran said the Salem VA Medical Center is not treating his insomnia and it is a service rated medical condition and he is getting Ambien, but it does not work.
I
The
got
veteran
Ambien in the
said he's
past. I got Ambien in the
100%
past.
PNT.
I got it in the
Okay.
past, and I even told them like it didn't work, but I give it a try. And it's like so they were able to do that one. Why can't they do the Lunesta
Okay.
if they're able to do that one, right? So I mean, like it was like they're gatekeeping. It's like I did everything that I'm supposed to, and it's like it's never enough, and it's frustrating. And so for then I had to have my outburst. Like, see, I'm getting myself worked up, like right now, thinking about. Like, I'm sorry, man. You see, it's like
No,
it's
just take a
designed that
deep
way.
breath. Take a deep breath. It's
Yes, man.
it's a lack of sleep probably too. Like you said, you haven't slept all night
Yeah.
trying to. The veteran said that the Salem VA Medical Center is not treating his insomnia, and in the service, and it is a service rated medical condition. Veteran said he's 100% PNT. All right, I'm going to save this and I'm going to send it off. Is
Thanks.
that's
You
the
did.
only
I
thing that you want
appreciate
to
your
put in
help.
there? Yeah, I just added more to the concern because
Yeah.
I understand that you're just like, hey, I'm in this position where, um,
Well, it's scary, and it's like there's a miscommunication somewhere, and it's like in this situation, like I just don't understand like why like they're just they want like they're willing to treat it, but they're not willing to give me something that actually works for it, like this specifically for insomnia, and I just and it pissed me off, and it's like it shouldn't be like that, you
well,
know.
and let me just let you know,
Yes,
yeah,
man.
you can't force an actual doctor or anybody at the VA to do any type of surgery or to prescribe medication. That's something that
Absolutely.
I've told veterans before is at the discretion of the people treating you. Like if you've already gone through the sleep clinic for all of the diagnosis and stuff, then you may
Well,
want to talk
yeah.
to your
Like,
primary
why
care
don't I
about
do
going back.
Well, yeah.
Yeah,
Do you
going
mind
back.
including that in there, or is it too late to include like why not like try doing like some sleep treatment or something like that? Like if there's like something that like I mean like be proactive about it. I mean like maybe there's something else that's like it's a severe issue. Like I want it's complicating my life. I want to address it. And if there's like ways to go about treating it better, like I'm all for it. I mean like that's what like. That's what I'm here for. I mean, that's what I'm trying to do. Like, I'm trying to fix myself. Like, I'm not trying to fight the VA. I'm really not.
Mhm.
Like, I'm just trying to, like, just get my health care and stuff. And it's like, like miscommunications and stuff are, I mean, don't know like the programs and, just trying to navigate the system. It's like not a seamless, transition. Like I said, I went through the integrated disability evaluation system and back in 2012, and it's you know didn't really work, and like that's at least in my I think that's why there's this line also is because the whole system didn't work, and it's like there's a problem in the system, and it's like I'm trying to tell them that there's a problem is like where the problem is, and they're not fixing the problem, and it's like veteran suicide. Why is there veteran suicide? Because of things like this. And it's like I said, I'm not suicidal, homicidal, or any of that. I'm in a good mind, place of minds, and have a positive outlook on life and moving forward and such. But I know where I've been. I know how dark it gets and stuff. And and it's like I want to try and help. Like Veterans Affairs, be better. And like that's the only way it can get better is if we work together. And it's like like I wish that we could like figure out something, but Like maybe even like have a town hall or something like that. Why
And
not?
so let me go ahead and just let you know. Veteran said that he wants to go to a sleep clinic and he wants to have his insomnia fixed because it is a physical condition and not a mental condition. So he needs a sleep doctor. So a sleep doctor should treat it. The veteran said that he wants to get better, and it will help him to be less frustrated and irritated and cranky if
Thanks.
he gets some sleep.
Thank you for that.
So I mean, yeah, I mean, like anytime
It's a little bit
anybody,
charming.
yeah, anybody, well, if anybody has like any type of condition like that where it is
Yeah.
related to sleep, I mean, Alexandria Huffington had done this whole thing about sleep and how it really does, it can mess up your whole body.
Oh
And
yeah.
so if you don't get enough sleep, that definitely, so I understand what you're saying there because I've heard it over and over again on the news about how if you're not getting enough sleep, it can mess with your balance in your body. And of
Oh,
course, you get anybody who doesn't sleep, of
Well,
course, you're going to get
yeah,
irritated,
and like I
frustrated, and
just had
cranky.
legal issues, for basically the same thing. Like I was back in December, I was a victim of assault, and she mishandled my case, the prosecutor, like the Commonwealth attorney, and I threatened a lawsuit against her, and she said I threatened to shoot her, and it's like I wish I had that one recorded, but no, and yeah, three Commonwealth attorneys versus me, yeah, I mean 2 years probation. But it could have been worse.
Right, so
I mean, I got arrested. I mean, they didn't even say it. Freaking I was man, yeah, that sucked. First time I been arrested. Well, I should say like it's second time. First time to bail out.
is there anything else I can assist you with today? I did write that
Oh
down.
no,
I added it
oh
to
no,
my
no,
notes.
you've been extremely helpful, and I'm glad I called back. Thank you very much. For your very
You're glad to be
thoughtful and courteous, assistance today. I mean, I felt like I was heard, and that means a lot. And thank you for what you do for us veterans.
all right. My pleasure. Thank you for calling the VA hotline. I wish you well. You take care.
Yes,
Have a
ma'am.
wonderful day. You take care and try to get some sleep. Bye bye.
Thank you. Bye bye.